Under eye aging can make you appear older than you feel. I'm here to guide you through the latest treatments and procedures that can rejuvenate your eyes and take years off your face. Join me as we explore everything from fillers to surgery and learn what really works. The best way to think about it is you have minimal changes, moderate, more advanced. Minimal is when you start to think about fillers, Botox, basically some possible volume changes. If you're a good candidate at that point, you're going to probably be younger, you're going to have good skin integrity, you might start to have some crow's feet, maybe a little frown line, you might even lose a little volume, like right under your eye called the tear trough area. That's a good candidate to get minimal type things. A little filler under the eyes, a little Botox, maybe some light changes of a peel or laser. Bad candidates is if you're getting a little more aging because you've been out in the sun a good bit and you've lost some of that skin integrity, then we move really into the moderate stage. And when we get into the stage, skincare is not enough anymore. You've got some accumulated sun damage. You're losing some volume. You're having some effects of gravity and you're having some muscle changes. Skincare, Botox is not going to be enough. You're going to need possibly some lifting or more volume. And you want to try to rebuild your natural anatomy from what you used to have. So you're trying to kind of bridge that difference before you might need to consider advanced rejuvenation. The best candidates at this stage are usually 30s, 40s. They're starting to feel like, oh my gosh, I'm starting to look like mom or dad. And you feel great, but you look in the mirror, you don't quite look like you feel. That's when we're moving into more of the advanced change. That's when people start considering full rejuvenation of their face. And what I mean by that is you have skin changes, you have pigment changes, you have age spots or sunspots, you have gravity changes, you're starting to not see a sharp jawline and have some jowls, you're getting thickness around your mouth, maybe some fine lines. If it's severe, people refer to it as a barcode. You start to put lipstick on and it runs because of these fine lines. That's when we need full rejuvenation, and that usually is correction, which involves surgery. Surgery allows us to release some of those ligaments that are pulling, recontour the facial tissues back to what they were, and then reset everything. In summary, think about your bed. I think it's a perfect analogy. Sometimes your bed's in great shape. You just need some new sheets. That's like skincare. And you might need a new pillow or something. That's like adding a little Botox. That's that minimal stage. Then you get into that moderate stage, which is also a stage that I call the bridge stage, where you're bridging the two. You're kind of going from what used to work as camouflage, now sometimes works and sometimes it doesn't, and you're going toward correction. So if you think about the minimal stage is camouflage and the complete rejuvenation is correction, that's why that moderate stage, you can do advanced skin techniques like chemical peels, you can do some laser. Some of the volume change, it's just not enough to do some fillers. It's cost prohibitive for you to try to rejuvenate everything with fillers when you can correct it with surgical changes. Back to the bed. If you had a mattress change and you had a box spring change, sure, you could get a new mattress and that's all you do. But at some point, you either need a new bed or you got to replace it. In the early days, you don't mind a little lumpiness or something. But when you start having a sway and you feel like your bed's almost like a taco, it's time to get a new bed. It's time to do full rejuvenation of your bed, just like your face, full facial rejuvenation. And so if you follow that progression and kind of identify where you are, then you know where you need to jump in.